Now we have Republican Mike Pence from Indiana. Mike Pence, great to see you.
You bet.
All right, Mike, let me just ask you right off the top. Is there anything President Obama said this evening that changes your mind? You've been opposed to this. Did you hear anything that opened the door from your standpoint?
Okay. Well, Larry, let me say, I think some of the consensus reforms that the president mentioned were certainly welcome. Republicans also were glad to hear the president open the door to malpractice reform. But beyond that, this was just one more speech about the same bad plan. The president, did not relent in his commitment to create a government-run insurance plan that not only do House Republicans, but the tens of millions of Americans know will lead to millions of Americans losing the health insurance they have and ultimately take us in the direction of a government takeover of health care. So there were a few consensus items. Glad to hear about the president opening the door for ending the scourge of defensive medicine, but with a government-run plan still at the center, this is just the same bad plan.
Mr. Pence, a couple times President Obama in this speech said this is not a government takeover, number one. That was a very important point he made. This is not a government takeover. And number two, regarding the government insurance option, he said something like only 5% of private insurance people will come into the government. Do you buy that? Will he defend that? Is that going to be a big issue tomorrow morning in the cold light of day?
Well, he cited the CBO a couple of times, Larry, but as you know, being probably my favorite economist, the CBO made those projections about enrollment in a public option based on some pretty rosy projections about a growing economy. Look, this economy is facing 9.7% unemployment. Companies back in Indiana, where I serve, are struggling to keep the lights on and the doors open. I think most Americans know the minute the federal government starts to offer a government-run health insurance plan and says to businesses, all you got to do is send us 8% of payroll in the form of a fee, tens of millions of Americans are going to hear their employer say, look, we love you, but we got to keep the business open, so we're going to cancel the insurance here, pay the minimum to Uncle Sam, and send you to the government. The American people know this, and the president's assurances or citations of statistics isn't going to change that.
Mike, a couple times Mr. Obama attacked insurance company profits and Wall Street profits. Are you surprised at that? Is that class warfare, or does that fit into the scheme of things?
Well, first off, I wasn't surprised by that rhetoric, but let me just say, I really do believe, and Republicans in Congress believe, that the antidote here is more competition. As the president rightly observed, now, a majority of states essentially experience a monopoly or a very small number of health insurance products that are offered for businesses. And we really believe the answer to that is to allow the American people and small businesses to purchase health insurance like members of Congress do, essentially on a nationwide basis across state lines. But the answer is not to launch a new government-run insurance plan that we really believe will lead to a government takeover.
All right, Indiana House member and one of the main Republican leaders in the House of Representatives, Mike Pence, we appreciate your time very much.
Thanks, Larry.